is Sachedina. I'm a gastroenterologist. I worked at Osler for over 30 years. I started working at the old Peel Memorial Hospital in 1990. For a while, I was the only gastroenterologist in the whole of the city, serving a population of over 250,000 for a year. I have a very strong family history of heart disease. My father passed away at the age of 52 with a myocardial infarction, and I have brothers with ischemic heart disease.
When I met Dr. Sachedina, he was having what we call class 3 angina, which is a significant cardiac condition, which usually alludes to blockages in the plumbing or the arteries of the heart.
I developed chest pain while exercising at home.
He had 2 separate procedures at the cardiac cath labs. Both of them were what we call percutaneous intervention, or in more layman's terms, that would be what we call a balloon angioplasty and deploying a culvert. It's like chicken wire fencing called stents to hold the artery open. These are arteries that behave like elastic bands, so to speak. They have plaque in them. The stents move the plaque to the side and create another lumen or hole for the blood to flow through.
I was well for over a year, and then again while exercising I developed chest pain and was again very quickly admitted for a second angiogram.
We do about 2,000 or more angioplasty procedures a year at William Osler, and we do over 4,000 angiograms a year at William Osler.
We actually have the highest burden of out-of-hospital cardiac arrests in Ontario. Our burden of cardiovascular disease is high and advanced, and that goes with the demographic of the population.
Patients in this population have a higher incidence of coronary artery disease, and this can lead to cardiomyopathy or heart muscle weakness. Patients with this condition can ultimately require a defibrillator surgery to help prevent them from dying suddenly from abnormal heartbeats.
We know we have the sickest populations. We also have the highest number of cardiac arrest patients that arrive at our cath labs, double the number compared to many of our neighboring labs. Given this complex population, we still achieve the best outcomes for 30-day mortality for multiple years in the province and 3rd best in the country. It's homegrown care. You shouldn't have to travel outside this region, and actually you shouldn't travel. If you want the best outcomes for heart attack, they happen close to home, right here.
We are able to do all of this with actually only 2 what are called cardiac catheterization labs. We run our labs extra hours to keep up with the burden. Many of us actually have a personal attachment to our catchment area. So it's not that we only work here. Many of us actually have a lot of family members who live here. And that makes the care that you give maybe even more important.
Having this new cath lab space will allow us to expand our program and introduce new procedures such as ablations, which can be very helpful in improving patients' quality of life.
What we've established thus far is that Osler provides extremely high-quality care. Unfortunately, capital structure is not funded provincially. We do need to raise the funds from our community. To support high-quality care locally without travel going forward, we desperately need the help of our community.
I very strongly feel that we also have to give to the Osler Foundation to make sure that the needs of the community in the hospital are met. I'm eternally grateful that I've been looked after so well that I now get to spend time with my grandchildren. I'm certainly feeling really well now. I am again able to exercise, and really I have no limitations in the ability to do whatever I want. So I'm forever grateful.
It's giving season. Give to Osler Foundation before December 31st and BVD Group will match it. Dollar for dollar, donate today.